going to discuss about the upper limb, lower limb, thorax and abdomen. So guys, I'm feeling very low today. I don't know why. Very low today. I did not have my sleep properly. I'm not feeling good. I don't know why, but my exams are there from 25 October, and so I need to revise everything I need to revise: anatomy, biochemistry. So today I'll be revising anatomy part. Today I will be revising, and some part of physiology also. Tomorrow I will be doing physiology, and 23 and 24 I will be doing biochemistry. 25 biochemistry exam. So let's see. So let's talk about the upper limb. So first we'll be doing the important things. So talking about the shoulder joint. Okay, let's talk about the shoulder joint. And we'll be doing embryology, anatomy, histology and all. Very low I'm feeling. Okay, so talking about shoulder joint. So shoulder joint, as we all know, it's a ball and socket synovial joint. Ball and socket synovial joint. We know this, right? Everybody knows this, that shoulder joint is a ball and socket synovial joint. But as a medical student, what else you should know about this? That is, you should know that shoulder joint is articulating surfaces, ligaments, blood supply, nerve supply, okay, and relations, movements. You should know all about this, okay? So let's talk about this. So shoulder joint is a ball and socket joint. The shoulder joint is a ball and socket joint. Shoulder joint is a ball and socket joint. Shoulder joint is a ball and socket joint. What is a shoulder joint? Shoulder joint is a ball and socket joint. We all know this. Whenever someone asks, we say shoulder joint is a ball and socket joint. What is the articular surface? Articular surface, ligaments and bursae related to this important joint, you can see. Now let's talk about articular surface. Articular surface, the joint is formed by articulation of the glenoid cavity of scapula and the head of humerus. Therefore it is also known as glenohumeral joint. Therefore the shoulder joint is also known as glenohumeral joint. It is also known as glenohumeral joint. Structurally it is a weak joint because the glenoid cavity is too small and shallow to hold the head of the humerus in place. So the head is 4 times the size of the glenoid cavity. However, the arrangement permits great mobility. Stability of the joint is maintained by the following factors. So one thing you need to remember, that glenoid cavity of the scapula and the head of humerus, they form the shoulder joint. Shoulder joint is a ball and socket joint. It's a type of synovial joint. Glenoid cavity of scapula and head of humerus form the joint. So it is a weak joint because glenoid cavity is small and the head of the humerus is shallow. Head of the humerus is shallow. Almost head of the humerus is 4 times the size of the cavity of the glenoid cavity of scapula. 4 times. Head is 4 times greater than the glenoid cavity. So it is 4 times larger. So that's why what we say that the head of a humerus is, that's why we say that the glenoid cavity is shallow and the head of the humerus is 4 times greater than the cavity of the glenoid of scapula. So however, this arrangement permits great mobility, but the stability of the joint is compromised. So here you can say, whenever I ask about the articular surface, you have to say glenoid cavity of scapula and the head of humerus. The head of humerus is shallow and glenoid cavity is small. The stability of joint is maintained by, so this provides a higher mobility, great mobility. Stability of the joint is maintained by following factors, that is the coracoacromial arch of secondary socket for the head of the humerus. So it is the Coracoacromial arch, coracoacromial arch, coracoacromial arch. So coracoacromial arch, rotator cuff and glenoid labrum. Glenoid labrum. So what you need to say is articulating surface. The joint is formed by articulation of the glenoid cavity of scapula and the head of humerus. Therefore, it is known as glenohumeral articulation. Glenohumeral articulation. Glenohumeral articulation. So the articular surface, the joint is formed by the articulation of the glenoid cavity of scapula and the head of humerus. Therefore, it is known as the glenohumeral joint. Glenohumeral joint. Glenohumeral joint. Head of the humerus and the shallow glenoid cavity of scapula. So it is a weak joint because the glenoid cavity is too small and shallow to hold the head of the humerus in place. The head of humerus is 4 times the size of the glenoid cavity. However, this arrangement prevents great mobility. The stability of the joint is maintained by the coracoacromial arch. The coracoacromial arch is also called the secondary socket for the head of humerus. It is also called secondary socket for head of humerus. It is also called secondary socket. This coracoacromial arch. This coracoacromial arch is also called the coracoacromial arch is also called the coracoacromial arch, or secondary socket for the head of humerus. The coracoacromial arch or secondary socket for head of humerus. So the coracoacromial arch is also called secondary socket for head of humerus. It is also called secondary socket for head of humerus. The musculotendinous cuff of the shoulder. It is also maintained by the musculotendinous cuff of the shoulder. So the this weak joint is stabilized, is maintained by the coracoacromial arch. It is also called secondary socket for head of humerus. Coracoacromial arch, musculotendinous cuff, that is rotator cuff of the shoulder, and the glenoid labrum, not cavity, glenoid labrum. Labrum means in Latin lip. Helps in deepening the glenoid fossa. The glenoid fossa is deepened by the glenoid labrum. Is deepened by the glenoid labrum. Is deepened by the glenoid labrum. Okay, the stability is also provided by the muscles attaching the humerus to the pectoral girdle, the long head of biceps brachii and the long head of the triceps brachii. Atmospheric pressure also stabilizes the joint. So the glenoid labrum helps in deepening the glenoid fossa, because the glenoid fossa is shallow. The glenoid fossa is shallow, hence it is deepened by the glenoid labrum. Hence it is deepened by the glenoid labrum. Hence it is deepened by the glenoid labrum. So this is the glenoid labrum. This is the glenoid labrum. This is the glenoid labrum. So hence it is deepened by the glenoid labrum. Okay. The glenoid labrum helps in deepening the glenoid fossa. Stability is also provided by the muscles attaching the humerus to the pectoral girdle, the long head of the biceps brachii. So stability is also provided the muscles attaching the humerus to the pectoral girdle. Attaching the humerus to the pectoral girdle, the long head of the biceps brachii, long head of triceps brachii also stabilize the joint. Okay, atmospheric pressure also stabilizes the joint. So what you can write here, you can write that the coracoacromial arch or secondary socket for head of humerus, secondary socket, that is the so the glenoid cavity is deepened by the glenoidal labrum. Labrum means slip. So it helps in the deepening the glenoid fossa, because the glenoid fossa is the shallow one. That's why to deepen that we have glenoid labrum. So what stabilizes? You need to remember that it is stabilized by the coracoacromial arch, rotator cuff, and the glenoid labrum. Glenoid labrum. So the shoulder joint is stabilized by the coracoacromial arch, rotator cuff, and the glenoid labrum. and the glenoid labrum. So this stabilize the your shoulder joint. Shoulder joint is stabilized by the coracoacromial arch. Remember this, coracoacromial arch. Coracoacromial arch, rotator cuff and glenoid labrum. So repeat with me. Repeat with me. What to repeat? Take home point is the glenoid cavity is the shallow, so it is stabilized by the coracoacromial arch, rotator cuff, that is musculotendinous cuff of the shoulder, and the glenoid labrum. So you need to remember this. You need to remember this. So what you need to remember? You need to remember that the coracoacromial arch, rotator cuff, and glenoid labrum stabilizes the uh, glenohumeral joint, that is shoulder joint. Shoulder joint also called glenohumeral joint. Now talking about the ligaments. The capsular ligament, it is very loose and permits a free movement. The capsular ligament, it is very loose and permits a free movements. It is least supported inferiorly where dislocations are common. Such a dislocation may damage the closely related axillary nerve. The capsular ligament, it is very loose and permits a free movements. Capsular ligament, coracohumeral ligament, transverse humeral ligament, glenoid labrum. So these are the ligaments. So what are the ligaments of the what are the ligaments of the shoulder joint? The ligaments are capsular ligament, coracoacromial ligament, transverse humeral ligament, glenoid labrum. So four are there. What are the four ligaments? Capsular ligament, capsular ligament. So what is capsular ligament basically? So what is capsular ligament? Capsular ligament, coracoacromial, transverse, and glenoid labrum. You need to remember GTC. G for glenoid labrum, capsular ligament, transverse humeral ligament, coracoacromial ligament. So you only imagine how humerus can be stabilized. One capsule will be there covering it. Coracoacromial ligament, the acromion of the scapula. Okay, coracoacromial ligament, and transverse humeral ligament and glenoid labrum, which depends the glenoid fossa. So talking about this, so if you see here, the capsular ligament attachment very loose and permit free movement. The attachment is very loose and it permits a free movement. The attachment is very loose and it permits the free movement medially by supraglenoid tendon, laterally anatomical neck of humerus, and anteriorly capsule it reinforced by superior, middle, inferior glenohumeral ligament. So the capsular ligament is very loose and permits a free movement. It is least supported inferiorly where dislocations are common. Such a dislocation may damage the closely related axillary nerve. Medially, the capsule is attached to the scapula beyond the supraglenoid tubercle and the margins of the labrum. So medially, what you can find? Supraglenoid tendon. And laterally it is attached to anatomical neck of humerus laterally, and anteriorly it is attached by the capsule is reinforced by supplemental bands reinforced by superior, middle, and inferior glenohumeral ligaments. So what you need to write in the capsular ligament? It is very loose and it permits a free movement. It is supported least in the inferior, hence it is inferiorly dislocations are common. Medially the capsule is attached to the scapula. Medially it is attached to the scapula, medially to the supraglenoid tendon tubercle. Medially, not tendon, supraglenoid tubercle. Medially supraglenoid tubercle. Okay, 1 minute. The capsule attached to the scapula beyond the supraglenoid tubercle and the margins of the labrum. Supraglenoid tendon, it is saying. supraglenoid tendon. Laterally, it is attached to the anatomical neck of humerus, and anteriorly, the capsule is reinforced by supplementary bands called the superior, middle, and inferior glenohumeral ligaments. Glenohumeral ligaments. So, this glenohumeral ligaments. Glenohumeral ligaments. Glenohumeral ligaments. Coracoacromial ligament. It extends from the root of the coracoid process to the neck of the humerus opposite to the great tubercle. It gives a strength to the capsule. Coracohumeral ligament. It extends from the root of the coracoid process to the neck of the humerus. It extends from the root of the coracoid process to the neck of the humerus opposite the greater tubercle. It gives a strength to the capsule. So, talking about coracoacromial ligament attachment, root of coracoid process to neck of humerus, root of coracoid process to the neck of the humerus. So, this much you need to write. So, talking about the coracoacromial ligament. So, this coracoacromial ligament attachment is root of coracoid process to the neck of the humerus. Root of coracoid process to the neck of the humerus. So how do you guys feel when there is an exam 3 days after and you have to revise all the syllabus and you have to revise such perfectly that you cover each and every point? So it's not possible. So let's talk about the capsular ligament. Again, let's revise. It is a capsular ligament is a fibrous ligament, fibrous layer of the joint capsule. Okay. Is a fibrous layer of the joint capsule. It surrounds the glenohumeral joint. It surrounds the glenohumeral joint. It is attached medially to the margins of the glenoid cavity beyond the glenoid and laterally to the anatomical. So laterally, it is attached medially to the margins of glenoid cavity beyond the glenoid labrum. And laterally, it is attached to the anatomical neck of humerus. Except inferiorly, where medially the attachment extends beyond the supraglenoid tubercle. Medially beyond supraglenoid tubercle. What is septic arthritis of the shoulder joint? A portion of epiphyseal line of proximal humerus is intracapsular. Therefore, septic arthritis of the shoulder joint may occur following metaphyseal osteomyelitis. Talking about synovial membrane. So guys, I'm ending this because I feel like my okay fine. So talking about the capsular ligament. So take it as a podcast only. I'm not going to write or do anything. Okay, so talking about the we talked about capsular ligament. It is medially, it extends beyond the supraglenoid tubercle and laterally to the anatomical neck of humerus, and anteriorly capsule is reinforced by superior, middle and inferior glenohumeral ligaments. There are three thickenings in the anterior part of the fibrous capsule to strengthen it. They are called superior, middle and inferior glenohumeral ligaments. Okay? Talking about coracohumeral ligament or coracoacromial ligament. It is a strong band of fibrous coracohumerus, strong band of fibrous tissue that pass from the base of the coracoid process to get to tubercle. See, coracoacromial ligament, root of coracoid process to neck of humerus. Coracoacromial ligament. Glenoid labrum, transverse humeral ligament. Coracohumeral ligament, strong band of fibrous tissue. It extends from the base, means root of coracoid process, to greater tubercle. To greater tubercle. Base of coracoid process to greater tubercle. Talking about transverse humeral ligament, it is a broad fibrous band which bridges the bicipital groove between the greater and lesser tubercle. This ligament converts the groove into canal that provides passage to the tendon of long head of biceps surrounded by synovial. So, transverse humeral ligament bridge upper part of bicipital groove of humerus, tendon of long head of biceps brachii pass deep to the ligament. So, there is a lot of difference between the BDC and Vishram Singh. So, the transverse humeral ligament, it bridges the upper part of the bicipital groove of humerus, according to BDC. According to Vishram Singh, it is a fibrous band which bridges the bicipital groove between the greater and lesser tubercle. So same thing is given. It is a fibrous band and it bridges the bicipital groove between the greater and lesser tubercle. Between greater and lesser tubercle, it bridges the bicipital groove between greater and lesser tubercle. The ligament converts the groove into a canal that provides passage to the bicipital groove is converted into canal that provides passage to tendon of long head of biceps brachii surrounded by the synovial sheath. What BDC is saying, the tendon of the long head of biceps brachii passes deep to the ligament. Okay, so same thing. So what I'm saying is, the glenohumeral ligament is there, right? So we have different ligaments. We have capsular ligament, we have coracohumeral ligament, we have transverse humeral ligament, and we have glenoid labrum. Okay. According to BDC, Vishram Singh classified it as a capsular ligament, glenohumeral ligament, coracohumeral ligament, and transverse humeral ligament. And the accessory ligaments, coracoacromial ligament and coracoacromial arch. So since I am following Vishram Singh, so I will be discussing it as the ligaments of the shoulder joint are capsular ligament, glenohumeral ligament, coracohumeral ligament, transverse humeral ligament. So three humeral: gleno, coraco, transverse. GTC, glenohumeral ligament, transverse humeral ligament, coracohumeral ligament. In accessory ligament, I will be talking about coracoacromial ligament and coracoacromial arch. Accessory ligament, coracoacromial ligament, or coracoacromial arch. So in the capsular ligament, it is a thin fibrous layer of joint capsule and it provides the high mobility. It is loosely bound and it